How to protect respiratory health when air quality is unsatisfactory or dangerous. Part 2 continued from the previous video in this channel. If you are still breathing, then please click like and subscribe while you have the strength. Smile. The lymph system and the respiratory tract. The lymphatic system plays an essential role in protecting the respiratory tract from harmful particles and microorganisms. It is responsible for removing excess fluid and waste products from the lungs, which helps to maintain a healthy environment for breathing. Lymph nodes are strategically located throughout the respiratory tract and act as filters that trap bacteria, viruses, and other foreign substances before they can enter the bloodstream. The lymphatic vessels transport this trapped debris to nearby lymph nodes where it is destroyed by immune cells. The tonsils are another important component of the lymphatic system that help protect against infection in the upper respiratory tract. They produce antibodies that target specific pathogens such as bacteria or viruses. In addition to its protective function, the lymphatic system also helps regulate inflammation within the lungs. When there is an infection or injury to lung tissue, immune cells release cytokines that trigger inflammation. The lymphatic vessels then carry these cytokines away from inflamed tissues, reducing swelling and preventing damage to healthy lung tissue. Maintaining a healthy lymphatic system is crucial for protecting your respiratory health. Regular exercise, hydration, and a balanced diet rich in antioxidants can all help support optimal functioning of this vital system. Mucus and cilia. Mucus and cilia are essential components of the respiratory system that help to protect our lungs from harmful particles. Mucus is a thick, slimy substance produced by goblet cells in the respiratory tract. The role of mucus is to trap particles such as dust, pollen, and bacteria that enter our airways. The cilia are tiny hair-like structures that line the respiratory tract. They move back and forth in coordinated waves to sweep trapped particles out of the airways and towards the throat where they can be swallowed or coughed up. Together, mucus and cilia form an important defense mechanism against harmful pollutants that we inhale every day. However, exposure to high levels of pollution can overwhelm this protective system, leading to inflammation, infection, and even lung damage. To keep your respiratory system healthy, it's important to reduce your exposure to pollutants whenever possible. You may consider using an air purifier at home or wearing a mask when outdoors during times of poor air quality. Maintaining good lung health through lifestyle changes like quitting smoking or exercising regularly can also support your body's natural defenses against pollution-induced damage. Antibodies. Antibodies are proteins that our immune system produces to fight off harmful substances like viruses and bacteria. When we breathe in polluted air, our body recognizes these particles as foreign invaders and starts producing antibodies against them. These antibodies attach themselves to the pollutants, marking them for destruction by other cells in the immune system. This process helps to prevent further damage to our respiratory tract caused by the pollutants. However, prolonged exposure to poor air quality can overwhelm our immune system's ability to produce enough antibodies. In this case, it becomes harder for us to fight off infections or illnesses caused by pollution. To support your body's production of antibodies, it is essential to maintain a healthy lifestyle with proper nutrition and exercise. You may also consider consulting with a healthcare provider about immunizations or supplements that can boost your immunity. In summary, antibodies play an important role in protecting our respiratory system from harm caused by pollution. However, taking proactive steps towards maintaining overall health is crucial for supporting their effectiveness over time. Airway smooth muscle. Airway smooth muscle is an important component of the respiratory system that helps regulate airflow. This type of muscle lines the airways and can contract or relax, depending on various factors. When exposed to poor air quality, such as pollution or smoke, the airway smooth muscle may become inflamed and overreactive. This can lead to symptoms such as coughing, wheezing, and difficulty breathing. To help protect your respiratory health in these situations, it's important to avoid exposure to harmful pollutants whenever possible. You should also consider using a face mask or other protective gear when necessary. If you do experience symptoms related to inflammation of the airway smooth muscle, there are a variety of treatments available. These may include bronchodilators, steroids, or other medications designed to reduce inflammation and promote healthy airflow. Taking steps to protect yourself from poor air quality is crucial for maintaining optimal respiratory health in both the short term and long term. By understanding how different aspects of your respiratory system function and how they can be impacted by environmental factors like pollutants or allergens, you can take proactive steps towards protecting your health now and in the future. Alveolar macrophages. Alveolar macrophages are a vital component of our body's immune system. These cells live in the air sacs of the lungs, known as alveoli, and help to protect us from harmful substances that we inhale. When there is poor air quality, such as during wildfires or pollution spikes, alveolar macrophages play an important role in defending against irritants and pollutants. They engulf foreign particles like bacteria, dust and smoke, which can cause inflammation in the lungs. However, when faced with excessive amounts of pollutants over long periods of time or very high concentrations at once, these cells can become overwhelmed. This can lead to chronic inflammation and damage to lung tissue over time. It is important to take steps to minimize exposure to harmful substances by wearing masks or avoiding outdoor activities during times when air quality is low. Additionally, maintaining a healthy lifestyle including regular exercise and proper nutrition may also support optimal lung function. By being aware of how alveolar macrophages work within our respiratory system, we can better understand the impact that poor air quality has on our health, and take action accordingly. Pulmonary surfactant. Pulmonary surfactant is a substance that plays a crucial role in protecting our respiratory system. It's produced by specialized cells and secreted into the lungs, where it coats the inner surface of the alveoli or air sacs. The primary function of pulmonary surfactant is to reduce surface tension within the alveoli, making it easier for them to expand and contract during breathing. Without proper amounts of surfactant, our lungs would have to work much harder to inflate and deflate properly. Additionally, pulmonary surfactant helps prevent lung collapse at the end of exhalation by keeping small airways open. This allows for more efficient gas exchange between oxygen and carbon dioxide in our blood. Premature babies often lack sufficient levels of pulmonary surfactant, which can lead to respiratory distress syndrome, RDS, a potentially life-threatening condition. In these cases, synthetic versions of surfactants are administered as part of treatment. While we may not think about it often, pulmonary surfactant plays an essential role in maintaining healthy respiratory function. Neutrophils, eosinophils, and basophils. Neutrophils, eosinophils, and basophils are types of white blood cells that play an important role in protecting the respiratory system from harmful particles in the air. Neutrophils are the most common type of white blood cell, and they work by engulfing and destroying bacteria, fungi, and other foreign substances in the body. They also release enzymes that can damage healthy tissues if there is inflammation. Eosinophils are another type of white blood cell that helps fight off parasites and allergic reactions. They release chemicals such as histamine, which causes swelling and redness but can help trap foreign substances like allergens. Basophils make up less than 1% of all white blood cells but still have a vital role to play. They release histamine during an allergic reaction causing swelling, itching or hives. They also produce heparin to stop clotting until immune cells come to defend against invading pathogens. Together, these three types of white blood cells help protect our lungs from harm when air quality deteriorates by attacking potentially dangerous particles entering our airway before it enters deeper into our lungs, where it could cause severe damage or illness. Conclusion: protecting your respiratory system from poor air quality is crucial for maintaining good health. By understanding the dangers of unsatisfactory or dangerous air quality and taking necessary precautions, you can reduce your risk of respiratory issues and other associated health problems. Remember to monitor local air quality levels and take appropriate measures such as staying indoors when pollution levels are high, using indoor air purifiers, wearing masks when outside, and keeping windows closed during peak pollution hours. Additionally, it's important to stay informed about potential symptoms of respiratory issues and seek medical attention if needed. With these steps in mind, you can protect yourself and your loved ones from the harmful effects of poor air quality on respiratory health. Stay safe.